where we've had a health system that is focused on hoarding data and keeping it within our boundaries of our organization, we're going to move to a system, and we are already, where the ethic and the business model will be sharing information. That's how we're going to create value. We're not going to see the resistance that we have today. What you're going to see is people pushing information, wanting you to have that information, and the business models that will support that. As Jay pointed out, it's less about the technology and it's more about people. So I'd like to start with a story about Dorothy Tillman. Dorothy cared so much about her aunt's personal health records, her information, that she got arrested for it. The story ends with Dorothy continuing to demand her aunt's medical records, the hospital unable to comply, security comes out, and she is arrested for criminal trespassing. As I speak to audiences, there's a couple of lessons that I think come out in this story. One is, as patients, as consumers, I sense we can all understand her wanting to have the information that is in those medical records. She's just spent 12 hours there. She's lost a night's sleep. She wants to take her aunt somewhere else for treatment. There's information in those records. There's findings from the doctors. What I want you to reach into is your own intuition, an understanding, a gut-level understanding that Dorothy had and that each of us has about the value of our personal health information. Now I'm going to come. Most people tend to think of the word platform as a technological concept. As Shahid and I use it, we use it much more broadly. It's not only a reference to the technological architecture, but it's also a reference to the business ecosystem. Number one, that platforms are not simply a nice to have, but they are a must-have to be able to unleash the data and the power that is stored in that data. Secondly, that platforms are complex. We'll paint you a picture of a mosaic as opposed to a photo that's clear as to how platforms are evolving in the marketplace, and we'll look at some of the key characteristics that you should be looking at as you try to understand the growth of platforms in today's healthcare market. If you read the history of the decision-making process that Apple went through to open up its API back in 2007, the decision-making process that Facebook went through to open up its API about the same time, it's a major rethinking of the notion of we as a company can do everything ourselves versus we want to build a business system where some of the EHR companies are getting it, where they're opening up their APIs. They're trying to turn into platforms. It's not an easy job. And others are still very much dug into the mentality, the mindset, the business model of, we're a product, we really don't want to connect with anybody.